That means the liver 1, this point is sedated on the downwards direction, that indicating we have sedated the liver energy. If we activate for the same point, you just apply the liver 1 tonification. Same point will be the sedation and then the tonification. We have done the tonification towards the energy flow. Towards the energy flow. The energy comes from the Tatun, then further it ascends. Where the energy get bifurcated from the stomach GB41. From the GB41, the energy is passing towards the Dadun, that is liver 1 region. Then it connected here. From here ascending to the upward direction. That means towards the energy flow, that is the tonification. Opposite direction of the energy flow, that's sedation. But however, both are required. Sometimes when the liver gets flares up, excessive heat is there, on that particular time redness of the eyes and also severe headache and other related problem like abdominal distension, burning sensation on the epigastric region, on the hepatic region, and the burning of the sole of the foot, that condition we need to sedate. So that time the sedation to be taken place, that time I advise you to bleed that point, that always is good. So what we should use, rather than needling, we just use the lancet, that would be better. So I just pull the needle to withdraw. Then if I wanted to tonify, then I close the hole. I close the hole, that indicating I don't want to disperse the energy outside. That's the reason I close it. Now let me see, this is the way we can apply. Now if the excessive heat is there, most of the time the liver toxicity is more with me, with everyone normally. So for the day-to-day clinical practice, each and every individual patient, sometimes where the coldness is not there much, but the hotness is there partially, then you just open this lancet and then insert this on the liver 1 region. You just put it this lancet for few seconds, then immediately you just withdraw. So immediately you just withdraw this and then you just try to press in this region. You will get some amount of the bleeding. So this bleeding to be taken place once few drops of the bleeding. So this will be good. So once we have taken out end of the bleeding. So in this way, the whatever heat is flares up, that will easily come out through this point. Number 1 procedure, which will be useful for the many more diseases related to the abdomen and head and neck related disorders as well. Apart from that, this is the Dun point indicating for the Shen related disorders. Again, it is the Shen is indicating hernia related problem. It is the umbilical hernia or the inguinal hernia or the hiatus hernia or something related to the lump or cyst on the abdominal region. That time lower border, lower region of the stomach having any problem, then certainly we can use this point, will be good for the hernia related conditions. Along with that, it's advise you, but when you can use the points, because the hernia is the malposition of that particular region, to make it that position appropriately on that specific place, what is required, spleen should take care of the proper positions of the particular organs. When the spleen having the malfunction, that also causes the problem. So therefore the Shen related problem, hernia related conditions, we just apply the needle on the liver spleen 1 point, use the spleen 1 point on the other side. Both the points are good point to treat for the hernia and other related disorders, the metabolism related disorders. Now always you just hold the hand, one hand with the support of the, yes, this is the pad, then you just apply peacefully. Then whenever we want to apply, we should be very careful, and we don't talk during the treating time, we don't see the phone, we don't engage for the other activities in front of the patient. That causes the much more contraindication to us, the bad impression with the patient. They feel that yes, I am not taking care of you precisely. So hopefully now we completed, these are the 2 points, then spleen 1 and then liver 1 for the many more diseases can be treatable for the digestive related disorders. Now coming to the next point to be known as a Xingqian. liver 2. So where is the half tune above the web margin? So this is the the great toe, and then is the second toe. You just see that half tune proximal to this region in the depression. We just apply the liver 2 point. Please apply. Liver 2 point in the depression, you just apply in the depression, where this is also called as a pa feng. This also point to be known as a pa feng. Pa feng means is the wind points. There are the 4 wind points are there, 1, 2, 3, 4. So therefore half tune above the web margin we have the points, but this point is the sun point and sedative point. Sedate the energy downwards direction. Now we applied the liver 1 is the tonification. We applied the liver 1 tonification towards the energy flow, but we applied the liver 2 point is the sun point, it is a sedative point, but anti-direction of the energy flow we applied towards the sole of the foot. Now the third point, this is also, you know that this anything is the fire is flares up in your hepatic organ, the eyes are getting the redness or something connected to that excessive heat in your body, or the during the temperature time you wanted to deplete, because the heat in the temperature especially on the intestine and liver also gets the fever. So to bring down, certainly we can use this point. Now the third point to be known as a Tai Chung, that is liver 3. So how to locate this point? Midway between these two toes, and then you can find the first and then second metatarsal bones. So in the metatarsal bones, this is the base of the metatarsal bone in the depression, but approximately 2 chun above from the web margin, 1 chun and then another 2 chun on the web margin, from the web margin in the depression. You just apply the liver 3. This is the great point, is also it is the source point. It is the source point. Right. Now we applied the source point liver 3. That is the really great point to treat for the vision related problem. Further it is the hypertension and also gastric related disorders. But mostly this liver 3 is the tendon point. Liver 3 is the tendon point. Now anything connected to the knee tendons and the ligament problem or the patella tendinopathy or the related to this upper knee pain or the below the knee pain or the back pain, anything connected to the knee problem, we can use the distal point for the knee pain. You just use the P6 1 point on the non-affected area of the pain, then affected area of the knee pain you can use the liver 3. Left knee pain is there, P6 you just apply on the right side, and then liver 3 applied on the left side of the knee region. This is one or other way will be good, but during the hypertension you can use it when we do have the excessive sugar is there, so that means his diabetes is higher level, that time you cannot use it this point, but you need to monitor. Sometimes it gets the hypoglycemia as well. Hypoglycemia, that means is that it goes to the below the sugar level and below the normal. So we should be very careful. This is, by the way, liver 3 is equivalent to the spleen 1. Spleen 1 you can use, this is taking care of the earth point of the liver, then liver 3 is equivalent to spleen 1. This liver 2 is equivalent to the H9 and then P9, but now we would like to apply the liver 4. Where is the liver 4 point is located? Please listen very carefully, you just have a look, otherwise you do a mistake. Now you just come down. So normally the liver 4 according to this comes here, but it's not here. But now the liver energy goes in this direction, then it crosses the tendon. This tendon name is the anterior tibialis. This is the tibialis tendon. So these are the extensor tendons, extensor hallucis longus tendons, extensor digitorum longus tendons, but this tendon name is anterior tibialis tendon. The tibialis muscles will become one tendon. The tendon is tibialis tendon. So this tendon medial side anterior to the depression of the tibialis tendon. So now this tendon is there inside of the depression on this joint name is anticrural joint. In this joint inside, that's called as a liver 4. How to measure? On the another way, this is the tip of the medial malleolus. tip of the medial malleolus. The tip of the medial malleolus. From here, one tune anterior to the tip of the medial malleolus. One tune anterior means front. So, one tune anterior to the medial malleolus, this point is liver 4. Right? So, now you just apply liver 4. What is the beauty of liver 4? You can use the 40 mm needle. So, liver 4 is, raise, you can use this. Liver 4 point is grandmother point. That means it's a connecting point to the liver and also the lungs pulmonary system. Now the problem is related to the lungs, and then liver can be treatable by activating this point. However, as I told you, but whenever there is the counteracting taken place, liver is counteracting on the lungs, that time it causes the much more shortness of breathlessness. That time definitely we can use the liver 4 in the depression. Exactly in the depression, we just use the bigger needle. Yes, we just apply the needle liver 4 and then we just insert to the deeper level, so that passes to the maximum to this level, right? So liver 4 can be applied here. So from liver 4 is the most of the skin related disorders and also allergy related eczema, psoriasis conditions, you can use this point. But always this we should sedate, sometimes will be good rather than tonification. Sometimes you do the tonification, sometimes you do the sedation as well. But now we are talking about the liver 5. Liver 5, most of the people having the confusion where this point is ideally located. This is the tip of the medial malleolus, 3 chun. From here to here, how many chun? 16. From here to here, how many chun? 16. Yes. From here to here is 13 chun. From here to here is 16 chun. From here to here is 19 chun. From the medial crest of the tibia and then the tip of the medial malleolus, the center is 13 chun. That means is the 6.5 chun. Now the 5 chun below, above, from the tip of the medial malleolus, this point is located. This is 6.5 chun. From here 6.5, this is as a 3.5. Yes, 3.5 chun. Now how many chun we do have? 5 chun proximal to this. So normally here we can find the point. So this point to be known as a liver 5. Liver 5, on the bone this point is located, not on the, this point is located on the bone, this point is located. So we just apply here also. Some of the texts they do have the points which is related to the spleen meridian at the border of the medial border of the crest of the tibia, the points are located, but on the muscles. But here the liver meridian is existing exactly below the border of the, immediately below the border of the tibia. So same needle we can apply. So for example, from here you just immediately border of the tibia towards the fibula. Towards the fibula we apply inside. This also liver 5. This also to be known as a liver 5 according to the some text. Now which point is it? This is the luvo connecting point. This is the necessary point and the communicating point or the passage points. Now coming to the Su Chungudu.
Just in the skin, sir. Why? Because it is on the bone, sir.
Yes, on the bone subcutaneously or the transverse cutaneous needling. This called as a transverse cutaneous needle or the zero needling method. But this method is the perpendicular needle. Now we are talking about the, from here is the 2 chun above. Then on the bone we just apply this called as a chung tu. So whoever not applied, come within, you just apply from here to here, upward direction. Yes. So always you refrain to doing like this. This is actually placing here is not good practice. Don't place the hand like the finger on the top of the crown. That's not really good. So whenever you just apply like this, hold it here and then apply the direction, which direction you wanted to apply. Like this, you just apply on the skin level. That's good, right? Now is the liver 7. Then liver 6. Liver 6 is the Veima, Nima and then Veima. There are the 2 points are there. This is also very good anesthetic point in the body, especially for the lower limbs. Now we are talking about the liver 8, liver 7, right? Liver 7 point, you just come down. This is the border of the tibia, isn't it? So border of the tibia, you just come forward. Border of the tibia, you just come forward. Where it ends, you come from here, it goes. Where it ends, that area to be known as the tibial tuberosity of the crest. The tibial tuberosity, where it ends. So that means that point to be known as a spleen 9. This point to be known as a spleen 9, which we day-to-day clinical practice we uses in our centers for the various condition. You press and then feel and then come, you can find the spleen 9. From here, one chone posterior to that, one chone posterior to the crest of the tibia, then from here to here, this called as a sequan. This called as a sequan. I think apply Imran. So sequan, you just apply here. Yes. Now you just see this is called as a sequan. C means is the knee, quan means is the gate. Knee gate is there. So from here you just apply the needle to the deeper level, but this will be really good point where the gastrocnemius muscles starts from here. So that place to be known as a sequan. This is the anything is the osteoarthritis of the knee or the swelling of the knee or the medial meniscus having the problem or the sports injury having the ACL tear. That means the anterior cruciate ligament tear is happen. So that particular time we can use this point. Now the further is the most imperative point, that's called as the liver 8. So liver 8 again you try to find out the medial end of the knee. This is the medial inside. The inside you come down the medial end of the knee. Medial end of the knee. The where it ends the medial end, you touch and feel, you can find the semimembranosus and semitendinosus, 2 tendons. But anterior to this tendon, the point to be known as a liver 8. Anterior to this semitendinosus tendon, liver 8 point is located. This point to be known as a somebody who haven't applied liver 8. Yes. This is the mother point and also the immune enhancing point. By the way, this is the very good point as I told you for the various condition. This equivalent to the K1 and then liver 8 both are same function, right? Because this is a more energetic point to treat for the liver when the liver indirectly support to your brain system. Therefore, K1 is equivalent to the liver 8. For the knee pain, especially on the medial side of the knee pain is there, that time definitely you can use this 2 point. Liver 7 and then liver 8 together is advisable. If the pain is on the dorsum region of the anterior region of the knee pain, but that pain is not good by using this point. But however, because the knee problem is every person's knee is different from the each person. Your knee is different, her knee is different, my knee is different, his knee. By looking is the same. How the face is face. In each and everybody's face, eyes, nose, mouth, lips, ears are existing. But face is different, isn't it? But the God created us is the different faces. Likewise, the knee also differs partially. So therefore, anything problem related to this knee pain also, anterior knee pain is different, the posterior knee pain is different, every knee pain is different from the each other. So hopefully we understand about these 2 points. Now coming to the liver 9 point is in bow. So that point is this is the tip of the medial malleolus. That means is the top, this is the medial end of the patella. From here 3 chun plus 1 chun, 4 chun proximal to this region, this point to be known as a, so is liver 9. Please apply somebody. ನೀವು ಹಾಕಿ ಬನ್ನಿ, ನೀವು ಹಾಕ್ತೀರಾ? ಓಕೆ ಹಾಕಿ. liver 9 on the cloth we can apply after wiping that particular region, right?